Hello, everybody, and welcome to our How To Corner. I'm Will Gray, and on today's episode, we're going to discuss how to stop neck pain. Before we get started, please like, share, follow, subscribe, turn on notifications, and hop in the comments and let us know, if you learned anything today, as well as anything you want us to talk about in the future. So let's get going. In today's episode, we're going to discuss the anatomy of the neck, what causes your actual neck pain, and how to treat neck pain. Now, let's talk about the anatomy of the neck, right? I wanted to show a couple of things that I thought were super important that a lot of people probably do not consider or don't even know about. Maybe you want to know, maybe you don't. So you may just fast forward through this part. But the neck itself, the spine of the neck, rather, is made up of seven vertebrae. Of the seven vertebrae, you have eight nerves. So that means that the actual nerves themselves do not equal in the amount of vertebrae, which is important because the last set of nerves comes out below your C7 process and it becomes your C8. So that's important because of the fact that we have openings in our actual bones in our neck. Okay. Those openings are called foramen. So those openings can be a canal opening. That's an opening, but it's actually from top to bottom, right? From the top of your head down your butt. And then the lateral openings are called the foraminal openings, specifically, right? So the reason I had canal underneath foramen because it's an opening, not necessarily a foraminal opening, but it is an opening, but it's your canal. And the reason I notated these two because you have things that get diagnosed and they call them canal stenosis, and one is called foraminal stenosis. So we're going to talk about in detail kind of how those two things cause you neck pain, right? As well as a few other things too. Now, let's look at the neck pain from four aspects. A lot of people who have neck pain or report to clinic or visit their doctor or talk to their uncle or their mom or their dad or whomever tend to be in these four categories as far as the pain they're having. It's either a muscle spasm, there's some disc degeneration going on that either you were told about, and it is actually called DDD, right? Disc degeneration disease. Or you have a disc herniation, or you may have a disc bulge, and then you have some nerve irritation. Now let's kind of dive into the aspects of these four things. With muscle spasms, most muscle spasms are tightness of the muscle due to weak muscles or overused muscles. Usually, when you have a spasm, it's going to pull on something, some part of your actual bone, because most muscles are connected to bones or tendons that connect them to bone. That compression or that pulling can cause the muscle to spasm, or what we like to call shorten, right? And that muscle becomes short, it spasm, it pulls on something, which can lead to an actual pinching of a nerve, which can lead to irritation at the very bottom, right? See, nerve irritation, right? Now, what further, makes this an issue, muscle spasms, that is the fact that if you have disc degeneration, which is the thinning of the disc that separates the bones or the vertebrae in your neck, that can make the actual spasms worse because now we have an involvement that's going to happen where you can have how can I say this, a compression of the lateral foraminal stenosis or lateral foramen, which causes you to have foraminal stenosis. I probably said a mouthful there, but in short, muscle pulls down, it spasms, gets tight, it compresses the bones of your neck together, which in turn compresses on top of the nerves. Next, you can have a herniation that occurs or a bulge. The reason I put this herniation versus this bulge together is because a herniation is totally different from a bulge. A herniation itself is when the disc or the circular sac, which is called your disc, basically ruptures and the nucleus pulposa or the jelly like substance inside of it leaks out and it starts to press up against a nerve. You can have a bulging disc is when the actual sac, the jelly sac, or the disc basically maintains its integrity, but it protrudes and pushes out onto a nerve. But it's still in the sac, right? There's no actual excretion of these jelly-like substance at all. Which is why when somebody says they have a disc herniation or a bulge, we tend to try to, use those together when we're, a lay person or just a regular everyday person. We think a bulge is a herniation. It's not. Cause you two different issues. One is probably going to result in a surgical repair, herniation that is, and a bulge could be a little different depending on the nature of the severity of the bulge. And last is the nerve irritation, which results from the above causes of pain. All the three things we mentioned above, muscle spasm, disc degeneration, disc herniation slash disc bulge, can cause you to have nerve irritation, which then causes you to have symptoms down your arm. Okay. Now, does that mean that the symptoms go down to your fingers? No, it can go to your shoulder. It can go to your mid arm. It can go to your elbow, depending on the compression of the nerve, what nerve is being compressed, and where. Muscle spasms tend to be a little bit more focal sometimes. So you may have a referral issue. Like, let's say you have headaches, right? And somebody presses on your shoulder, right? Your shoulder is actually painful. Now your head hurts. Or somebody presses on your neck and then your head hurts. It's like, oh my God, I have a muscle spasm that's causing me to have a headache. That's why the muscle spasm referral pain can be a little bit um, ghost like, where you can't really pinpoint it sometimes. But it's usually in an area. It doesn't really dissipate down your arm or diffuse, issues down your arm, right? So with the nerve irritation, there tends to be a lot of different quote unquote presentations you can get, but for the most part, it's going to be radiating symptoms down your arm that you should focus in on: tingling, numbness, shooting electrical pain. Right now, how do I treat the neck pain? Now, me being a physical therapist, I'm going to talk about PT to begin with. Um, the best thing I can say, all PT is not created the same. It's just not. We're not all conducive to doing our job at a high level. No healthcare provider is. I know that seems taboo, but it's the truth. Now, in physical therapy, you have manual therapy, you have strengthening, and you have decompression therapy that can occur. The manual therapy tends to target the spasms themselves, okay? Try to address any restriction you may have of any kind, as well as do any cervical adjustments that need to be done or any alignments that need to be done to help you offset some of that actual discomfort. When you think of muscle issues or therapy, you think of strengthening. But the type of strengthening that occurs for a neck issue can be different depending on the cause or the issue itself, right? Meaning that if I have a neck issue, a lot of people want to get you in a better posture, so they'll work your scapular muscles. And then, if the strengthening doesn't work, they'll try to introduce some level of decompression, which can be tied into manual therapy or it can be actual cervical traction. Okay, be careful with traction because traction can cause you to have irritation, nerve irritation, depending on how you're doing it, how much force you're being applied to your neck, and just the constant intermittent versus static holds of traction. Now, let's say you move past, trying to do that and you get to medications, their injections, their over the counter medications, their prescriptions. Those situations tend to vary as far as when you need what, but these are the actual things that most medications or medical providers like to go to, right? And then the last part is surgery: fusions, laminectomy, discectomies, all those different things can occur, may have to occur depending on the cause of the pain. And a lot of times when you have some of these procedures occur, they can become, how can I say, a problem in the future, or they cannot. They can be great, right? It just really depends on the approach and the surgeon themselves. So when you consider treatment, what I would suggest, try to find you a really good therapist, try to find a medication that possibly could work for you, or muscle work or cream of some kind, before you have to get to the place of using injections and surgeries and all that thing. Before we end, I want to say thank you to everybody who made it to this point in the video. Like, share, and subscribe. Tune into our podcast, Will's World, Your Will Overall, where we do a lot of motivational, positive things. We discuss things of all different kinds, and as well as follow us on all our platforms. Facebook, here on YouTube, as well as Instagram, where we share a lot of the same information, but we share some cooler things also in different places too. And I hope you learned something today. If you did, please leave us something in the comments. Let us know. If you did not, that's fine too. But just share the information, what you did learn, and what you saw on our podcast, or as well as our YouTube channel that could help other people. And with that being said, everyone, I hope you have a blessed one. I'll catch you in the next one.